up next, we have Dr. Scott Barbuto joining us. Dr. Barbuto graduated from the Tri-Institutional MD PhD program in 2014 with a medical degree from Weill Cornell Medical College and a PhD from Rockefeller University. He completed residency in physical medicine and rehabilitation at New York Presbyterian Hospital, affiliated with Cornell and Columbia University. Upon completion of a one-year neurorehabilitation fellowship specializing in the care of individuals with neuromuscular and movement disorders, he accepted a position of assistant professor at Columbia University Medical Center in 2019. He currently conducts research on the effects of exercise on neuromuscular disorders and is a member of the MDA clinic at Neurological Institute at Columbia. With that, I will hand it over to you, Dr. Barbuto. Thank you for being here.
No problem. Can everybody hear me?
Yes.
Yes. Okay. I'll apologize if my dog barks in the background. Hopefully he'll be quiet. So I'm very happy to be here. Was just introduced, I work at the MDA clinic at Columbia, and I am a physical medicine doctor. And my primary role is to develop exercise programs for people with neuromuscular disorders. As a secondary part of my training, I also treat any pain that comes up from the patients. And today I'm going to be talking about pain in SMA. I have no disclosures for this presentation. So as many of you are aware, there are 4 different types of SMA, and the type that you have usually the age of onset kind of dictates which type you have. And the younger that you start, usually the more severe the disease is, where you can see that in type 1, usually younger than 6 months, they are unable to sit or roll independently. Whereas if you have type 4 and you are develop the disease over the age of 18, you have mild walking difficulties. So just taken from a textbook, this is what they say about SMA. So the main symptom is weakness. It causes muscle atrophy, which is basically a shrinking of the muscles. There is a lack of deep tendon reflexes. There are fasciculations, which basically mean that the muscle may spasm. And there can be even some rapid or discrete movements of the muscle that are not voluntary, such as trembling. There's usually genetic testing for the deletion in the SMN1 gene, which we were just talking about. But what I really want to focus on is these signs and symptoms. And what you'll notice is that one of the things missing from these signs and symptoms is pain. So do people with SMA have pain? What is the, do they have more pain than normal, or what is the deal with that? And it's not really been researched very often. I could only find one study looking at pain in SMA patients. And in the study, it really was a very small study, which they only included 17 adolescents with SMA. However, this is the best we have looking at pain in SMA. So this is what we are going to kind of guide our discussion on for pain in SMA. So what we have here is a graph. Can you see my arrow, hopefully? What you have here is the SMA patients in the darker color here. And you'll see that only 20% or so had no pain. That means that 80% had some sort of pain. Now, the frequency of pain did vary. Some people had monthly pain, weekly pain, daily pain, and some people were in pain all the time. In fact, 71% complained of chronic pain in this study. Taking a look at the breakdown, we're going to be focusing on these blue areas here. And this is the duration of how often they were in pain. And you can see that the pain did vary from less than an hour, which was most common, but some people had pain that lasted greater or equal to 2 days. You'll also see that the location of the pain did vary. Most commonly, the pain was in the neck or back, followed by legs, but some people did have pain in the shoulders and arms and other areas. You'll see that the number of locations of pain also varied, with most people having pain in up to 3 to 4 different locations. And here you can see the average pain intensity for people with SMA was relatively mild. So most of the pain was mild. Okay, and so we're going to move on to looking at what caused this pain. And here we have a breakdown of the percentage of people who complained of pain from too much sitting, 46%, too much movement or activity, 39%, being lifted and transferred, 62%, so that was a big one. Movement exercises about a quarter, stretching, standing, dressing, walking, those are all about a quarter. Most people didn't really have any pain with bathing and swimming, wearing orthotics, wearing braces, no real pain. So really the main ones are these top 3, too much sitting, too much movement, or being lifted or transferred. So what did people do to relieve this pain? Well, the majority of them, especially if the pain was caused by too much movement or exercise, resting was the thing that they did to relieve this pain. For someone maybe sitting too long, changing position helped. Others used massage, use of some sort of medication, stretching, bathing or swimming, relaxing, and movement exercises. There's also a device that some people use that's called a TENS machine. This provides electrical stimulation to the sore muscle and kind of tricks the fibers, these pain fibers, and gives you a different sensation, which also can help with pain. So the main takeaway points from this study was that pain was prevalent in SMA, even though it's not really part of the definition of patients who do have SMA. Most pain was considered minor, but this does not mean that people with SMA should live with pain. The disease does not cause pain itself, but complications from the disease can cause pain. Too much sitting, bad posture, need for help with transfers from others. And there are things that can help with the pain, as we saw from below. So that was really the only study that was published that I could find that was dealing directly with SMA and pain. So this is obviously an area that needs a lot further consideration, and it's something that really has been not studied well. What we're going to be talking about now is kind of determine why individuals with SMA may be prone to pain, determine the common causes of pain, and maybe learn some treatment options. And at this point, I will allow anybody, if they have any questions, please feel free to chime them in the chat. I do like to do questions as we go along with the presentation, so feel free to chime in, or either unmute yourself or you can put it in the chat box. Okay, so why do people with SMA have pain? Well, the main symptom is weak muscles, and that's caused by muscle atrophy, which basically means a shrinking of the muscles. As you can see here, this is what it is. Here's a biceps muscle that is considered normal and healthy, and then you get these smaller muscles caused by this disease. Can this be reversed? It depends on what the cause is. These weakened muscles are more likely to fail. They're more likely to have tears or pulls. And as you can see here, you have a nice, full, healthy muscle. And you can see that the muscle fibers are making up 95% of this muscle here, the biceps. Whereas 1% is fat and 4% is connective tissue. Whereas if we look at an atrophied muscle, what we see is that there's only about 70% muscle fibers. You have more fat, and you have 25% of connective tissue. So we now know that these weakened muscles are more likely to tear and fail, but also these weakened muscles put strain on tendons, which are the connective tissue of these muscles to the bones, as you can see from here. So this is a tendon and this is a tendon. So we're going to put more strain on these tendons and also more strain on these bones. And so you can have tears or rips in the tendons, and you can also have breaks in the bones. So let's now examine these sites of pain and see what are some of the common causes in SMA and other neurological diseases. So we're going to start with the most common, as we saw from our graph. Neck pain is very common. And the most likely cause of neck pain is just sore muscles. Well, why would you get sore muscles? Well, it's usually caused by poor posture. Your neck muscles are weak. And so what winds up happening is you tend to drop your head down. And dropping your head down can cause the muscles in the back of your neck to get sore. The first line treatment for this is physical therapy. And we also want to look at other factors. So if someone is sitting in a wheelchair, we want to really examine that wheelchair and really make sure that the patient is sitting in the proper location and is most comfortable, and that the wheelchair in itself is not causing this pain. Other things that we can do for this is we could use some sort of brace, such as a soft collar. This usually is more for comfort and less for holding the neck up. There are other braces that are more rigid, but most people find them uncomfortable and not the best to use. Lastly, what we can do is we can do what's called trigger point injections. This is where we take lidocaine and we inject the lidocaine into the muscle using a needle. The needle is really used to break up muscle fibers that are kind of in a mesh and tight. And so we use the needle and the lidocaine to kind of relax these muscle tendons, and this can really help with pain in the long term. Another common cause of neck pain is nerve pain. And what do I mean by this? So hopefully you can see my arrow, and so we are looking at a neck here, and we can see that we have the spine and we have discs, and coming out of the sides we have nerves, and these nerves run from the neck into the arm. What can happen is, because of the weakened muscles of the neck, you can place more strain on the spine, and this can cause there to be disc tears, disc bulges that can pinch these nerves that are coming out of these small areas in the neck. When you do get this pinched nerve, you can get pain that stays in the neck and maybe migrate to the head, or you might even get some electrical signals or electrical shocks down the arm going all the way to the fingers. First line treatment is medication followed by PT. The first line treatment is gabapentin or Lyrica. The main side effect of these medications, though, is getting sleepy, and so some people can't tolerate them. After that, we do physical therapy to kind of help relax the nerve. We do something called nerve gliding, where we kind of allow the nerve to be relaxed and release it from the tension that it is under. The next line treatment would be an injection into the neck. We can do either a steroid injection, which basically is taking a medicine that causes inflammation to be decreased and decrease this inflammation that is surrounding this pinched nerve that will help relax it and cause there to be less pain. There's also things called cervical nerve blocks, where we kind of take these, the nerves, and we kind of stop them from sending out any painful signals. And so by doing this, we can prevent the pain from continuing. So now we're going to move on from the neck and we're going to move on to the shoulder. And if there are any questions, I think I see one here, maybe, but I cannot open it. So if someone wants to read it out, if there is a question, please do so. So we're going to move on to shoulder pain. One of the most common causes of shoulder pain in people with SMA is a rotator cuff tear. The rotator cuff is composed of 4 different muscles: the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. I wish I could. I see there's another question now, but I cannot actually allow.
Yes. So it was actually just one question. Does massage help?
So in terms of back for the neck pain and the neck muscles, it really depends on the cause of the pain. And as you saw from here, massage in 1/4 of the patients was helpful, but it really depends on what the cause of the pain is. If the pain is caused by muscle pain, massage usually does help. And it usually is very helpful in helping with the pain. However, if it's not muscle pain and it is bone pain or nerve pain, usually massage is not that helpful. Okay, excellent question. Feel free to chime in with questions as we go. Okay, so we have these 4 muscles that are basically making up the shoulder. And because of the weakened muscles, these place these tendons at risk. And so as you can see, the tendons where these muscles insert can become inflamed and can actually tear. And if you get these tears, they can be extremely painful, especially when trying to raise your hand to, say, wash your hair. So there's also pain can be caused by manually using a wheelchair. Say that you have very poor leg, you have a lot of leg weakness, but your arms are okay and you're actually using a manual wheelchair. Well, that propulsion of that wheelchair can cause a lot of stress on those shoulders, especially if your shoulder muscles are weakened. So the main treatment for this is time, allowing these tears in the tendons and the muscles to repair themselves. We also do some physical therapy to kind of increase your range of motion during this time, usually not strengthening at this time because we don't want to tear the muscles any further. If there is a complete tear, and how will we know there would be a complete tear? Well, we would do some sort of imaging like an MRI, and that would show that the tendon has torn completely. If that's the case, the only thing that you can really do at that point is a surgical repair. Okay. Next, we're going to talk about shoulder pain with subluxation. Well, what is subluxation? Well, if your arm is weakened and it is dangling at your side, what can happen was just by gravity, the shoulder joint can kind of slide out of place. So you can see that this is where the joint is in its normal place. But since you have this gravity always pulling down on it, what you can do is you can get a separation of the arm from the shoulder joint. The treatment for this usually is a sling or brace. As you can see on the bottom of the picture here, this is what a brace would look like. Other options are electrical stimulation, like the TENS machine, which I mentioned earlier. And we usually do PT for mobility exercises, range of motion, keeping that shoulder in a good spot. Lastly, for shoulder pain, we're talking about a bicep tendonitis. Well, what is bicep tendonitis? Well, because your bicep is now weakened, your bicep attaches to the shoulder up here on the top and also below at the elbow. And because of the weakened bicep, you can put more strain on the tendons and you can get tears in these bicep tendons, either the long head or the short head, usually the long head. And they can be very painful. So the main treatment is, once again, rest with ice to reduce swelling. You can try some NSAIDs or anti-inflammatory medications, such as naproxen, ibuprofen, Aleve, which can be helpful. But really the trick is to rest and allow these tears to heal themselves on their own, which they will, as long as it's not a complete tear. And finally, some physical therapy to kind of strengthen the bicep and once you have a repaired tendon. Okay, we are going to move on to the back now, unless there are any questions. I don't see any. Okay, so the main cause of back pain is usually, once again, muscle pain. And a lot of people with SMA have scoliosis. Well, what is scoliosis? That is shown here on the bottom pictures. So normally we have a nice straight spine. But what happens with patients who have SMA is usually there's a curve, basically an S curve to the spine. And because of this curve, the muscles of the back don't sit in the proper places. And it can lead to the pulling of back muscles and more strain on one side of the back than the other. And so if you look at this curve here, with this type of curve, you're going to be putting more pressure on this right side of the back, the right lower back, compared to the left side. And that can cause right lower back pain. The main issue is obviously ice to reduce the swelling, as well as NSAIDs, rest, physical therapy, and once again, these trigger point injections with lidocaine to kind of help calm the muscles. There's also back pain due to disc pain. So as we talked about in the neck, we have the spine, and in between the spine are discs. And what the discs do is it provides a cushioning for the spine. But because of the weakened muscles, there is usually more stress placed on these discs. And because of that, these discs can actually tear. And there are pain fibers in these discs, and it can cause pain. Typically, the pain is produced with prolonged sitting. Usually, heating the muscles is particularly helpful. I usually like to tell people to ice the area at bedtime, usually heat in the morning to kind of get your back moving. Once again, some anti-inflammatory medications to calm down the swelling and physical therapy. Once again, these tears usually do heal on their own. And with back pain, we once again can have pain due to the nerves. The nerve can be compressed by bulging discs. And now, instead of pain radiating down the arm, we can get pain that radiates down the leg. Usually, there are two levels that are the most common to have pain just because they are have the most movement. That's the L5 level, which usually causes pain down the side of the leg. And then also the S1 level, which can cause pain going down the back of the leg. First line treatment, as with neck nerve pain, is gabapentin and Lyrica, physical therapy, and we can do the epidural steroid injection to calm down this inflammation in this area and help with the pain. We're going to now move on to leg pain, and particularly spasms. So what causes spasms? Well, it's caused by spasticity, which is basically a disruption of a complex nerve circuit that controls muscle and stretch reflexes. What does that mean? Well, we have our muscles here, and we usually are getting signals from the brain and the spinal cord telling these muscles that it is okay to relax. And when this signaling is disrupted, what can occur is that the muscles will tense up and get really tight, causing tightness and spasms. So what does this mean? Well, usually the pain, you get muscle pain and these spasms, usually worse at night, mainly because during the day you don't notice them as much, but at night when you're trying to sleep, people do get these spasms that can be quite painful and prevent people from sleeping. The main way to treat this is with stretching. Stretching the muscles, kind of getting this tightness out really does help. There are medications that can be used to treat these spasms, the main one being baclofen, but there are others such as tizanidine, dantrolene, and Valium, which can be used to help with spasticity. And then there's also some other muscle relaxants that can be used, such as Flexeril or Robuxin, which can all help. And here I just showed that the main things, treating leg cramps, people say that drinking more fluids may help, massaging the cramped muscle, and basically cooling down the skin can also be helpful. I will say that another treatment option, which I didn't place in here, if these medications aren't helpful, some people actually can even get Botox injections into the muscle to relax them and prevent them from being so tight. Now, this is something that you do not want to happen. And the way to prevent this is by doing range of motion exercises. But when you do not move your muscles, what can happen is the tendons, which are the parts of the body that, once again, connect the bone to the muscles to the bone, these tendons, if you don't stretch them, they can shorten. And if they shorten, they basically prevent your range of motion in different muscles. The most common one maybe being in the foot and your ankle. And you'll have decreased range of motion. It'll prevent you from having normal range of activities and can be quite painful. So usually the best defense is prevention with range of motion exercises. If you do develop a contracture, you can try bracing, where you can kind of stretch out that tendon again, but that will take months and is usually not too effective, to be honest. And usually people will actually have to undergo some sort of surgery to have a tendon lengthening surgery if you do get a contracture. So you really want to try to avoid this. And the best way to avoid this is to do these range of motion exercises daily. I even tell patients that they should be doing it up to 3 times a day. Okay, we're going to move on to the hip. And I'm going to basically just talk about one thing on the hip. And at this bony prominence right at the side here, there is a little area, like a little hole where you can develop fluid. And this usually occurs due to abnormal walking. So you're not walking the proper way and you're kind of limping, and this can cause the hip to be inflamed, and this area, it's called the bursa, to get filled up with fluid and be inflamed. This actually responds extremely well to steroid injections. And we also do physical therapy to kind of help correct the walking and try to prevent this from occurring. The main issue people have with this is they have difficulty sleeping at night, because if they lie on it or they press on this prominence on their hip, it can be quite painful. And I'm running out of time, and this is actually going to be the last joint I'm going to be talking about is knee pain. And most commonly in SMA, what we develop is knee arthritis. And this is usually caused by abnormal stress on the knee. So because you have weakened primarily quadriceps, but other leg muscles, what you wind up doing is you use your knee for added stability, and you hyperextend your knee, meaning that you bend it back too far and you lock it in place to try to create the stability you need to maintain your walking and your stance. But by doing this, you are actually damaging that knee joint. So this can lead to knee arthritis. And so once you have knee arthritis, we do the ice and heat again, usually once again, heat in the morning, ice at night, physical therapy for range of motion exercises, NSAIDs to calm down the inflammation, and people do get steroid injections, or hyaluronic acid injections also are helpful for this. Having said this, if you are walking and you are hyperextending your knee, you can prevent this by using some sort of brace to kind of prevent your knee from locking. However, if you do that, you may be more unstable when you're walking around, and that may not be desirable as well. So at this time, I would like to open it up for questions. And thank you for your time.
All right. Thank you for sharing your comprehensive discussion on pain management, Dr. Barbuto. If anyone has questions, now is the time. Looks like we have one. Thank you for this helpful info. Other than rest, are there any treatment options for pain focused from pressure from sitting when not enough fat tissue there to cushion bone?
Yeah, so that is definitely an issue, is that, you know, as you don't have these muscle mass to kind of prevent you from, give you some additional cushioning, the main treatment is actually not sitting in the same spot for too long. And so basically repositioning every 2 hours. There are particular types of wheelchairs and also mattresses, particularly the Rehab mattress, which has special air pockets, which help prevent pressure sores from developing. And so that's usually the best method, is basically getting these specialized equipment to kind of relieve the pressure. It distributes the pressure in different areas, and it can really help with that type of pain.
Great, thank you. Another question, what happens when steroids don't work for hip pain?
That's a good question. So I should clarify and go back a little bit when I talk about hip pain. Most hip pain, when you actually have hip pain, it actually isn't on the outside part of the body here. The hip is actually more, people, if they have hip pain, it usually is groin pain that is the main issue. And that's the actual hip joint. For that type of pain, there's different treatment options. Steroid injections are one of them into the actual hip joint. For this greater trochanteric bursitis, however, if that is where you're having that pain on that outside part of the thing, steroid injections work, I would say 95% of the time if it's placed in the right location. If it doesn't work, then I most likely would think that that's not the proper diagnosis, and I would look for something else as a cause for the pain, such as maybe a stress fracture, of pain of the bone in the area, which would be a different treatment, or there's actual pain within the actual hip joint itself, and we would treat those differently.
Thank you. Not seeing any additional questions, but we'll just give it one more moment in case anyone is typing something up here.
And I'm going to stop sharing because I cannot actually type anything in the question and answer. So I'm going to just place my email into, if I can, into the chat. And if anybody has any additional questions, feel free to reach out to me. Although I don't know if I can actually do that. Let's see.
If not, we can share that out as well, either way. Thank you,
I-
everyone. Okay. Thanks so much, everyone, for your questions. And thank you again, Dr. Barbuto, for your participation. We appreciate you being here and look forward to having you back in the future.
Okay, thank you so much.
Thank
Bye,
you.
everybody.
Bye.